Good morning, everyone, and thank you for joining us. Before we begin, I just want to let you know that this webinar does offer closed captioning. To enable closed captioning, click on the blue widget or the CC in a box located on the bottom left of your screen. Today's webinar will be covering the Chicago vaccine requirement that goes into effect on Monday, January 3rd, 2022. This webinar is being recorded and will be made available on our YouTube channel, which is youtube.com/ChicagoVACP. For questions, please use the chat box and send your questions to all panelists. There will be a Q&A session at the end of the presentation. And the chat box is located on the bottom right of the screen. And make sure you click on all panelists to send your questions. Today's webinar will be an overview of health metrics, the Chicago vaccine requirement, and information for businesses. I would like to introduce Dr. Erica Taylor with the Chicago Department of Public Health, who will give an overview of the health metrics. Welcome, Dr. Taylor.
Thank you so much. It's a pleasure to be here. I just wanted to give an overview of the current stats that are affecting our community right now. We are currently seeing roughly 2,069 cases on a daily basis. And so we're in the very high risk group at this point. In regards to COVID-19 test positivity, we have a current rate of 8.3%, and that is expected to continue to increase. And that puts us in the high risk category. In regards to hospital beds occupied by non-ICU hospital beds occupied by COVID patients, we currently have 541 beds occupied, and that number is also expected to increase. And then in regards to ICU beds occupied by COVID patients, our current rate is 174, also with an expected increase. In regards to hospital beds, those numbers are increasing here in the city. And so that's one of the reasons why we're really encouraging people to get vaccinated and boosted. Next slide, please. This is just another way of showing some of the same information, again, showing that here at the top that our cases are 2,069 per day. Last week, we were at 1,029 daily. And so again, those numbers continue to increase. Our hospitalizations are at 64 daily. We're roughly at 65 per day last week. And then again, our deaths are also increasing here in the city at 9 per day. And we were roughly around 8 last week. In regards to Vaccination Administration, that number has dropped slightly this week. 13,450 vaccines were administered over the course of the last week. And then in regards to tests performed, that number has increased with 30,522 tests performed on a daily basis. And again, our case positivity rate is 8.3%. Last week, we were at 4.2%. Next slide, please. In regards to COVID infection, the rates are increasing among our unvaccinated compared to fully vaccinated individuals. And so if we look at data roughly around the week of Thanksgiving, we are 3 times as likely to see infection in unvaccinated Chicagoans compared to the fully vaccinated. So again, and the importance of being vaccinated. Next slide, please. In regards to our hospitalization rates, we're also seeing an increase in the rate of unvaccinated individuals being hospitalized at a 5 times higher rate compared to fully vaccinated. Again, we started to see this sharp uptick in cases since Thanksgiving. And again, looking at unvaccinated versus fully vaccinated here. So a 5-fold increase. Next slide, please. In regards to COVID deaths, those numbers are also similar to the hospitalization. So again, there's a five-fold increase, which started roughly around Thanksgiving. And again, you're seeing that unvaccinated individuals versus fully vaccinated individuals have a 5 times greater rate of dying if they are infected with COVID versus someone who is fully vaccinated. Next slide, please. Where can I get vaccinated? So vaccines are widely available here in the Chicago area. You can contact your local pharmacy to make an appointment online, check with your healthcare provider. There is an at-home service that will actually come to the home and provide vaccines for up to 10 individuals. In regards to other sites, we have community events. The City of Chicago has various vaccine sites throughout the city, Chicago Public Schools, and you can also go on ZocDoc. You can call 312-746-4835 to find out locations for vaccines, or visit Chicago.gov/COVIDvax. Next slide, please. What does it mean to be fully vaccinated? So fully vaccinated means that you have had at least 2 weeks after receiving your second dose of a 2-dose series. So that would include Pfizer or Moderna vaccines. In individuals that have received a single dose vaccine, such as Johnson & Johnson, you would also have to have 2 weeks that have bypassed before you would be considered as being fully vaccinated. So if you don't meet the above requirements, regardless of your age, you're not considered to be fully vaccinated. I'll now turn it over to Miguel.
Good morning, everyone. My name is Miguel Campos. I'm a supervisor with the City of Chicago Department of Business Affairs and Consumer Protection. You can go to the next slide. So I'm here today to talk to you about the new Chicago vaccine requirement. So as stated earlier, effective January 3rd, 2022, the Chicago Public Health Order 2021-2 will go into effect. That order states that any individual who's 5 years of age or older will be required to show proof that they are fully vaccinated against COVID-19, to dine indoors, visit gyms, or enjoy entertainment venues where food or drink are being served. Individuals under the age of 5 may enter establishments that require a vaccine without displaying their proof of vaccination, as long as they wear a mask, except when they're actively eating or drinking. And as a reminder, children aged 2 and under are not required to wear a mask. This new public health order will remain into effect until the city is through the Omicron-driven surge and the risk of overwhelming our hospital capacity has passed. These are signs that are available, social media graphics that anyone can download by visiting Chicago.gov/COVID. And again, the one on the left, Chicago vaccine requirement, beginning January 3rd, the city will require proof of COVID-19 vaccination for certain indoor public places. So you must have a valid photo ID for anyone who is ages 16 and older, and a vaccination card or photocopy of your vaccination card, a digital record or app, or a printed record from a vaccine provider. These are signs that are available for businesses for you to print on your own. So again, the one on the right is just informing the public that proof of vaccination will be required for certain types of indoor public spaces, including indoor dining, indoor fitness, and indoor entertainment and recreation venues where food or beverages are served. So I'll get into some of the details as to what type of entities are required to ask for proof of vaccination. So any covered entity would be any facility offering indoor dining, which would be establishments where food or beverages are served, including but not limited to a restaurant, a bar, a fast food establishment if you have on-site dining, coffee shops, tasting rooms, cafeterias, food courts, dining areas of grocery stores, breweries, wineries, distilleries, banquet halls, and hotel ballrooms. In addition to indoor dining facilities, indoor fitness facilities are required to ask for proof of vaccination. This includes gyms and fitness venues, including but not limited to a gym, a recreation facility, a fitness center, a yoga facility, a facility offering Pilates, cycling, bar, and dance studios, hotel gyms, boxing and kickboxing gyms, fitness boot camps, or any other facility that is used for conducting indoor group fitness classes. A question that has been asked the city already is, are individuals allowed to use a locker room to change clothes without showing proof of vaccination? That answer is no. Any indoor fitness venue must comply with the Chicago vaccine requirement, even if entering guests are not using the facilities. I mentioned indoor entertainment and recreation venues where food or beverages are served. These include, but are not limited to, movie theaters, music and concert venues, live performance venues, adult entertainment venues, commercial event and party venues, sports arenas, performing art theaters, bowling alleys, arcades, card rooms, family entertainment centers, play areas, pool or billiard halls, and other recreational game centers. Part of the health order is asking that all covered entities comply with OSHA standards 1950.501 E and G. This is relating to employee vaccination status and testing, depending on the number of employees that you have. So this is for business owners and operators who are joining the webinar today. We'll cover more in detail what this means. The vaccine requirement is for patrons. There is a testing requirement that would apply to your employees. Essentially, your employees, if they are working in an area of a covered entity where patrons must be vaccinated, have to at minimum test on a weekly basis. So that's essentially what OSHA standards E and G stand for. There'll be a link at the end of the webinar where you can read on that, and I'll cover in detail what those standards mean as well later in the webinar. So the city's order requiring proof of vaccination in public places does not include houses of worship, a grocery store. However, if you have an indoor dining section in your grocery store, that area of the grocery store, you would be required to ask for proof of vaccination. Any location inside O'Hare or Midway International Airports is exempt from this vaccination requirement, as are any kindergarten through 12th grade private or public schools and daycares. Any location in a residential or office building for which the use is limited to residents, owners, or tenants of the building is exempt. So there is no vaccination requirement for a gym inside a condo building, for example. And then food service establishments that provide only charitable food services, such as soup kitchens. In addition to those exempted locations that I just mentioned, there are individuals who are exempted from the city's order, and they do not need to provide proof of vaccination. So the first one are individuals who enter an establishment for less than 10 minutes to order or carry out food, make a delivery, or use the bathrooms. So if you are only offering takeout service and you're a fast food establishment, you do not need to ask for a vaccination requirement. People come in, they place their order, and they take their food to go. This would apply if you're picking up delivery or takeout for you to consume at home. This also applies to Uber Eats or Grubhub driver who is only entering to pick up an order and leave. So in these instances, you as a business owner do not have to ask for proof of vaccination. Any non-resident performing artists and accompanying non-residents who do not regularly perform or render services in a covered location. So if you are public place of amusement, you're a concert venue, you do not need to ask a non-resident of the city who's an artist performing at the show to provide their proof of vaccination. The same would apply to a professional athlete or staff members of a team who are visiting and entering the location as part of their regular employment. So trainers, coaches, things of that sort. Individuals who have previously received a medical or religious exemption, provided that that patron provides the entity proof of their medical or religious exemption and a COVID-19 test that was administered by a medical professional within 72 hours prior to entering the location. Then any individual that's 18 years of age or younger that is participating in an activity organized by a school or after-school program, an individual voting in a municipal, state, or federal election, or if pursuant to federal law, someone who is assisting or accompanying a voter that is voting in a municipal, state, or federal election. What type of food service establishments are not required to comply with the Chicago vaccine requirement? So I mentioned earlier, if an establishment offers only takeout, delivery, or outdoor dining, and any indoor tables, chairs, or other furnishings normally used by patrons for indoor dining are blocked off, then you will not need to abide by the vaccine requirement. This falls in line with someone who's coming to pick up or order food and they're there less than 10 minutes. So if you are a fast food establishment and you do not wish to check vaccine status of employees, you can simply decommission your indoor dining facility and continue to operate as a takeout or delivery establishment only. Next slide, please. So does the order apply to outdoor dining structures? The short answer is no. The order applies to any part of a covered location with a roof or overhang that is enclosed on at least 3 sides. It does not cover temporary outdoor structures for multiple parties that have at least 50% of the sides open to allow airflow, nor dining structures for individual parties, such as plastic domes that have adequate ventilation to allow for air circulation. We're trying to get ahead of some questions that are going to be repetitive. So who must comply with the Chicago vaccine requirement policy when a covered premise is being rented out for a wedding or other event? So any commercial event or party venue, as well as a hotel, meeting, or event space must comply with the vaccine requirement if food and beverages are being served. A covered entity, in the interest of efficiency, may allow patrons to provide the requisite proof prior to entry, either directly to the covered entity or through an intermediary such as an event planner. And again, are individuals allowed to use a restroom facility without showing proof of vaccination? Yes, customers and patrons entering an establishment just to use the bathroom do not need to show proof of vaccination, but they are still required to wear a face mask. So again, business requirements for the vaccine requirements, we are asking that each covered entity develop and keep a written record describing the protocol for implementing and enforcing the requirements of the order. Such written record should be made available for inspection to any city official authorized to enforce this order. Any member of the Chicago Department of Public Health, the Department of Buildings, Business Affairs and Consumer Protection, and the police department have the authority to enforce this vaccine requirement. We've gotten dozens of questions already asking if we would provide a template for written records or how these should be kept. This vaccine requirement applies to a number of industries across the city. We'll be providing guidance as to what items you could or should be including in your written records, but we don't want to give any templates. Depending on your type of business, you might find certain aspects easier to enforce Obviously, if you're, let's say you're a hotel, you can establish some sort of prerequisite or like check online where people attending a wedding can provide their documentation ahead of time, so you don't have to do it on site. That would obviously not work for if you're a restaurant. You more than likely want to be checking vaccination records at the door. Some of you bars are already engaged in this through the normal operating methods. You're carding people to ensure they're over the age of 21. You have a system that works. So we won't be providing any templates, but we will provide guidance. What we are providing for businesses are a template of documentation for ensuring compliance among your employees and compliance with the OSHA rules and regulations that I mentioned earlier. So again, to get us back on track, as a business, you're required to develop a plan of how you're going to enforce the vaccine requirement. And then you must also post signage at each publicly accessible entrance and in at least one location inside your business, informing patrons of the full vaccination requirement. So these are examples of two that are available that were produced by the city. So vaccination and masks are required. That's the one on the left. And then vaccination and masks required in this section. If you have an indoor component to your business and an outdoor component of your business, you might find this useful. You would not need to check vaccination status for areas that are outdoors. So if you have an outdoor patio, things of that sort, you can choose to have a vaccination section and an unvaccinated section. And that's what this stands for. They're available to download by visiting Chicago.gov/COVID. Our mask mandate is still in effect. That is House Order 2021-01. So we are asking that you check vaccination status and you must still abide by the existing mask mandate that's been in place since August 20th of this year. I'll quickly cover over that or go over that House Order. Most of you on here have already been enforcing it and know what to do with it. So again, face coverings must be worn in all indoor public settings, regardless of your vaccination status, except when you're actively eating or drinking at a restaurant, bars, or similar eating establishment. Certain personal service activities that require the removal, such as beard shaves or facials, and then employees and settings not open to the general public. If your employees are static and maintaining 6 foot of social distancing, do not need to wear a mask. Other than that, a facial cover is required for everyone over the age of 2. So to quickly cover again, outdoor setting would be an open air stadium, a park, a parking lot, a sidewalk cafe, an outdoor patio or an expanded outdoor dining area, a rooftop or retractable roof, an outdoor tent that has at least 50% of its sides open, igloos or other one-party enclosures, and then indoor spaces where 50% or more of a wall can be removed via the opening of windows, doors, or panels, provided that dining tables are within 8 feet of said openings. So anything that we would consider an outdoor setting, you would not have to check the vaccination status of patrons sitting in the outdoor settings, only for indoor settings. Indoor setting is any commercial and residential building, a hotel, recreational centers, including bowling and arcades, a museum, personal services establishment, retail stores, performance venues, for example, a movie theater, hospitals, and then public transportation, which includes taxis, ride-hail, and delivery services. So our mask mandates of businesses are required to ensure customers and employees are adhering to the new face covering mandate, which isn't new. It's been in effect since August. And then you are required to notify customers prior to entry about the face covering mandate. So now you'll have two signs, one with the vaccine requirement and then one with the facial covering requirement. You are asked to post signage that says masks are required for all customers regardless of vaccination status. These are also available at the Chicago.gov/COVID. And again, as in August, the vaccine mandate is not placing any additional restrictions on your business. So we are not at the level where we feel the need to reinstill capacity restrictions, social distancing requirements, or limit your hours of operation via curfews. We're hoping that that does not happen. Can switch slides, please. And then before we get to questions, any questions that we are unable to answer, if you would be kind enough to send an email to bacpoutreach@cityofchicago.org, we'll get an answer to you as soon as we can. Today is the first of 3 webinars that we are having in a couple of weeks prior to the beginning enforcement or the vaccine requirement goes into effect on January 3rd. So in addition to today, we'll have another webinar next Wednesday at 11 o'clock in the morning, and then on Tuesday, January 4th at 2 p.m. As you ask questions that we may not have the answer to, we're hoping to have them on future webinars. So if you wish, you can sign up for those webinars. We'll have more information as this is a living and breathing health order that we're rolling out. There are going to be some questions that we do not have the answers to. Ahead of opening up to questions, I'll go over some general questions again that we've already had. I've covered some of these already. So does the new health order apply to outdoor dining structures? It does not. So it only applies to indoor dining or indoor dining areas. It does not apply to anything that we would consider to be an outdoor setting. A question we've gotten is if a vaccine requirement policy has to be enforced if a venue is being rented out for a wedding or a holiday party or birthday party, etc. Our answer is yes. Commercial event and party venues, as well as hotel meeting and event spaces, must comply with the vaccine requirement policy. I briefly covered an establishment having both indoor and outdoor portions of operation. So for example, an indoor fitness center that has an outdoor pool or a museum that has indoor and outdoor spaces, only the indoor portion is covered by the vaccine requirement policy. A question we've gotten is what if an establishment is being rented out by a house of worship for a religious event? If it's being rented out by a house of worship, then that for that event, the order requirements would not apply. We've covered the vaccination requirements if it's a polling place. So if your location is being utilized as a polling establishment or polling place for any election, you would not need to check vaccine status at the door. Again, customers are allowed to use a bathroom without showing proof of vaccination if they are entering simply to use the bathroom. That does not apply for a locker room where someone's changing. There is a difference there. Then a question we've gotten is how will the city be enforcing this proof of vaccination? So again, the order can be enforced by the Commissioner of Health, the Commissioner of Business Affairs and Consumer Protection, the Commissioner of the Buildings Department, and the Chicago Police Department. As with other previous health orders and COVID restrictions, you are subject to a fine and potential one-day closure or longer in egregious situations. We've gotten multiple questions from hotel operators regarding the employee testing portions of the health order. So one question that we've gotten is, does vaccination or test requirement apply to all staff in a hotel or those working in the covered areas of the property? Our answer is, if a hotel has under 100 employees and part of the hotel has a covered location, so indoor dining area, only the workers in the covered location have to comply with the order. If you have over 100 employees and you're a covered location, the OSHA vaccination and testing requirements apply across the board. And again, we will in the chat put up the link to where the OSHA regulations can be found. I stated earlier that businesses were asking if we would provide templates, written records or protocols for implementing the requirements. We will put guidance to provide you guys assistance in drafting a protocol. We will not provide a template. We are, however, providing a template for verifying the testing requirements based by OSHA. Those are available at Chicago.gov /COVID already. We've gotten questions regarding professional services inside spas. So if food and beverages are offered as part of your spa services, then the vaccine requirement applies to you. If you are not providing food and beverage as part of your spa services, then you would not need to check vaccination status. We've gotten questions regarding pools as well. Indoor pool would fall under indoor gym or fitness center, and outdoor pool would not. We got questions about culinary staff that's working in the kitchens. We are recommending that the culinary staff working in the kitchen of a covered location follow the order. That is a recommendation. You should, however, follow the OSHA standards. So all employees within a covered location should follow the vaccine requirement or testing option. We've gotten questions regarding parameters for proof of negative test for employees. Those are detailed in the OSHA standards, which again, we will put the link up to those in the chat box. And then we can also provide it if you reach out to us via email. We've gotten questions with regards to staff cafeterias. So a staff cafeteria would not fall under the vaccine requirement. Your staff does not meet our legal definition of a patron, and it is a space that is not open to the public. So we would consider it to be part of a location within a residential or office building that is only limited to certain people in there. So you do not need to check the vaccination status in a staff-only cafeteria for those of you running large-scale operations. And then the last question that we've gotten multiple versions of are public spaces of hotels. So if someone's sitting in the lobby and they decide to bring in their own food or beverage, does hotel employee have to walk over and verify the vaccination status? No, it is not an indoor dining area. Proof of vaccination is not required if a guest is bringing their own food and sitting in an area where you as a business would not normally engage in the activities of providing food or beverage. However, again, face masks must be worn when anyone is not actively eating or drinking. And then just as a reminder for everyone, any business can choose to place stricter guidelines on your property. Our vaccination for indoor settings only is a floor. You can choose to require that any patron entering your place of business for any reason be fully vaccinated, and you can check vaccination status. With that being said, hopefully I answered some of the questions that were posed. I will now turn things over to Lisa, who will go through the chat and ask any questions that I have not answered as of right now.
Thank you so much, Miguel, and thank you, Dr. Taylor, as well, for providing the health metrics. We did do a little kickstart to the Q&A, so hopefully Miguel answered some of your questions. If we do not get to your question, you can email us at bacpoutreach@cityofchicago.org, and we'll answer your question that way as well. Our first question is, does this order apply to suppliers that make a delivery to an establishment? For example, food and beverage vendors making deliveries and entering into restaurants.
It would not. Someone is dropping off a delivery. Realistically, should not be taking longer than 10 minutes. So you do not need to check the vaccination status of vendors. So your produce guy or meat guy making deliveries, or your liquor delivery you would not be required to check the vaccination status. But again, you can choose to do so if you so desire.
Another question came in. Will we be provided a Cdph approved sample vaccination policy for bars and restaurants, similar to what is already done for vomit incidents? Like Miguel mentioned, we are providing a guidance for the written record that is required by businesses. It will cover some suggestions and just basic coverage, just due to each business and industry being unique. So we'll just have some simple guidance, and that should be coming in the next couple of days. A question for you, Miguel. If you are a caterer and events are held at different venues, is the venue owner or manager responsible for checking vaccine cards prior to entry?
It'll ultimately be the responsibility of the license holder. And again, this is one of the reasons that we are only providing guidance. Some of you might choose to let your event planners handle the vaccination status ahead of time. Some of you might decide to have your own staff check it on site. It's really going to depend on the type of your business. So if you're a caterer, it's obviously not your responsibility as a caterer. You're being hired to work at a licensed location. It would be the responsibility of the location to check the vaccination status. You are simply showing up as a subcontractor or employee for the day to provide your services for that day.
Miguel, there's a question of, if you are an entertainment center that is not serving food, do all guests entering the facility have to be fully vaccinated?
That is a question. If you can please send to bacpoutreach@cityofchicago.org to get you a definitive answer. It's going to depend on do you have a food and liquor license and you're choosing to not offer that service, or do you not have one and you're simply an entertainment venue? But if you would email bacpoutreach@cityofchicago.org, we would confer with the law department and our partners at the health department and get you an answer.
Next question, Miguel. If an entertainment venue shuts down its food service completely, will that eliminate the need to ask for proof of vaccination?
That's similar to the question that you just asked a couple of seconds ago. We would get you guidance and provide an answer on that shortly.
Thank you. Question is, in construction, do crews traveling together in a truck need to be vaccinated?
I would refer you to the OSHA regulations. That is employee section of it. The vaccination requirement would not apply that you are an establishment or patron. So depending on the number of employees that you employ, you would have to follow OSHA regulations.
Thank you. For sports facilities that rent out space, do the group organizers or the facility handle the vaccine requirements? And I'll just take that one. So it is up to just a collaboration between the sports facility and the group organizers. The public health order says that an intermediary can handle verifying proof of vaccine. So it's just at your discretion. And when BCP investigators would show up, we just asked to see that written protocol that outlines who was in charge of checking proof of vaccine. Question is, do employees of companies that deliver goods and services to restaurants, bars, entertainment venues need to prove vaccination to enter? For example, food and beverage distributors. Does the 10-minute threshold apply? Yes, a person can enter a covered location for less than 10 minutes if they are delivering a package or placing an order and then leaving the covered location. Just a simple question of if these slides will be available. This webinar is being recorded and will be made available on our YouTube channel, which is youtube.com/Chicago VACP. And we will also be hosting this webinar next Wednesday, the 29th, at the same time at 11 a.m. So you're free to join that one, as well as on January 4th at 2 p.m. Question is the required signage available in other languages? We are working on translating the signage into other languages, and that will be posted at Chicago.gov/COVID for download.
as Elisa reads through the chat and looks for further questions, some of the most commonly asked questions, we will be publishing a frequently asked questions PDF or Word document that we seem to be getting, understandably so, a lot of repetitive questions. So it will be available for you to view at Chicago.gov/COVID under business guidance, so that you can see if questions that you may have already been asked and answered.
Yes, thank you for that, Miguel. And we do have a frequently asked questions document already available. We updated with information probably every several hours. So I do recommend checking it out just to see what's going on now and as we continue to update the document. Question came in of, will proof of vaccinations be required for visitors to enter animal shelters? You do not need to ask for proof of vaccinations for patrons entering animal shelters. Animal shelters are not considered a covered location under the health order. Question is, does the proof of vaccination requirement apply to retail stores that do not serve food or drink? It is not required to ask for proof of vaccination at retail stores. Question is for kids 5 and up. What if they are not currently vaccinated? Can they still participate or enter with weekly negative COVID tests? All patrons age 5 and older need to be fully vaccinated to enter a covered location. There is not a test out option. You need to be fully vaccinated.
And then just to provide a little more background on Elisa's answer, that would be to enter a facility where food or beverages are being served. Once again, a covered location does not include a K-12 private or public school or any after-school events that are being held on school grounds. So we're not saying that like your unvaccinated 7-year-old cannot participate in this basketball tournament. That is not the case. But in order to enter a restaurant, a gym, fitness center, or entertainment venue, that is, or recreation venue that is not on school grounds, they would need to be vaccinated.
Thank you for that addition. Question is, are hotels required to have the vaccination mandate or requirement signage on their front entrances or only in the fitness center and meeting rooms? So we do have business signage that says in this section. So for example, going back to that. So there are 2 signs available. The one on the right says in this section, for example, grocery stores that have dining areas or sections, they can have this sign posted just over there. Same thing with hotels that have fitness centers, the sign of in this section, or they can use vaccination and mask required signage right there on the fitness center. Miguel, not sure if you're able to answer this one, but how about room service in a hotel? So dining in your own room.
No, you would not need to check that vaccination status upon making room service deliveries. It would cover general areas of the hotel that are open to the public. So a ballroom, a meeting room, if you have a restaurant as on the ground level of your hotel, it would apply there, but not for room service.
Miguel, if you want to answer this question, if the meeting planner has a list of guests that they checked are vaccinated, does the hotel need the list or just the planner that compiled the list?
That would depend on whatever protocol the hotel decides on. If your written protocol is going to be that the event planner will be checking vaccine requirements and they'll have the list when a member of the city of Chicago shows up, if that's what's on your plan, then obviously the city personnel would go to the event planner to look at that list. So that's an area that's open to whatever plan you want to implement. If for your own legal protection, the hotel wants to have a copy of it, then that should be listed on their plan. But that'll be part of the guidance that gets provided within the next couple of days.
Question came in of if we are a nonprofit community center with children's leagues and programs, are we required to check vaccine status for children? And that falls under individuals that are exempt from the order. Any individual 18 years of age or younger who enters a covered location to participate in activity organized by a school or after school program, whether it's pre-K up until grade 12, does not need to abide by the order. Miguel, a question for you. Does this vaccine requirement apply to one-on-one personal service businesses such as spas and massage parlors?
It does not. Again, unless you are providing food or beverage services as part of the services that you're offering. So if you have an incidental liquor license and you're providing cocktails with a facial or a massage, etc., then you would be considered to be an establishment where food or beverages are being served. If that component of does not apply to your business, then you do not need to abide by the vaccine requirement. But however, do still need to ensure that patrons are wearing and employees are wearing a facial cover unless the service being offered requires the removal of the facial cover.
Okay, well, thank you so much for everyone joining us. There were a good amount of questions that we just don't have time for to answer, but we please encourage you to shoot us an email at bcpoutreach@cityofchicago.org. We do want to answer your questions, so please send us an email. And like we mentioned, there is an FAQ document already posted at Chicago.gov/COVID. That is going to be updated as things get added to it. We also just reshared the OSHA link in the chat box, so you could reference it there. Thank you so much for joining us, and we will be posting this webinar on our YouTube channel, which is youtube.com/ChicagoVACP. Thank you.